Good afternoon again, everyone. Thank you for joining PVA's webinar this afternoon, the overview of VA's home and community-based services and caregiver programs. My name is Heather Ansley, and I'm the Associate Executive Director of Government Relations for PVA. Before we get started with our presentations this afternoon, just a couple of housekeeping items. So first, just a reminder that today's webinar is being recorded and will be available for viewing on pva.org. Also, we do have closed captioning available for this webinar. Please click the CC button in your meeting controls bar at the bottom of your screen to turn it on. Also, if you have any questions today, we ask that you please use the Q&A box that is available on your screen. We will be collecting questions and asking them at the end of today's presentation. So again, please use the Q&A box. Now I'm going to turn it over to Roscoe Butler, who will introduce our presenters and give us an overview of today's webinar. Roscoe?
Thank you, Heather. Good afternoon, everyone. I want to welcome you to today's webinar. During today's webinar, our presenters will be providing an overview of VHA's program of comprehensive assistance for family caregivers, the program of general caregiver support services, home care programs, which includes home-based primary care, medical foster home, adult day health care, VHA's purchase home care program, which includes skilled home health care, Homemaker home health aid, Respite Care, veterans directed care, and access with technology. It is my pleasure to announce that we have two presenters from the Veterans Health Administration. Our first presenter will be Ms. Leah Christensen, who is the National Clinical Program Coordinator for Caregivers Support Service Program. Ms. Christensen is a licensed clinical social worker who has spent her career supporting families in healthcare settings. Ms. Christensen began her career in pediatric oncology and palliative care at Oregon Health and Science University, and then at Stanford Children's Health Care. Her career with the Department of Veterans Affairs began with the Caregiver Support Program when it was implemented in 2011. Our second presenter is Ms. Cheryl Smits, who is the National Director for Home and Community-Based and Purchase Care Programs for the Geriatric and Extended Care Services. Ms. Smits has spent 25 years working in various inpatient and outpatient settings in the commercial healthcare arena. She began her VA career with VHA's Office of Community Care in April of 2017 and transitioned to her current role with the VHA Office of Geriatric and Extended Care Services. So our first presenter, I'll turn it over to Ms. Christensen.
Thank you, Mr. Butler. And I just want to thank you, PVA, for inviting us to participate in this webinar today. Very honored to be here. I want to start by acknowledging and really thanking the veterans who are here with us on the webinar. Thank you for serving our country and for the many sacrifices that you have made for us. And I also want to thank those caregivers who are in the room with us. We see you and we acknowledge the important role that you play as well. I'm very pleased to speak with you about the VA Caregiver Support Program. As Roscoe mentioned, I've dedicated really the past 10 years to serving veteran caregivers, first directly as a clinical social worker at a VA facility, and then at a regional level, and now from the national level. And so it's really an honor to be able to support those who care for our nation's veterans. Next slide, you'll just see here that, as Roscoe had also mentioned, I will be speaking about the two programs that fall under the Caregiver Support Program. So those two programs have really long names, and we often refer to them with the acronyms. So they're the Program of Comprehensive Assistance for Family Caregivers, or PCAFC, and the Program of General Caregiver Support Services, which we refer to as PGCSS. Next slide. The mission of the Caregiver Support Program is to promote the health and well-being of family caregivers who care for our nation's veterans through education, resources, support, and services. So why is caregiver support important to VA? So the way that we see it is really just as veterans serve, so now do their families in the care and the support that they provide. And so it's our role at VA to care for them. So those of you who are caregivers here at this webinar, it's our role to help support you and to care for you too. Caregivers are often the ones that we know are providing care day after day and supporting veterans in their home, in facilities all over across the country. And that support is really critical. And many of the veterans who are enrolled in the Veterans Health Care Administration report that they are in need of a variety of different types of care in the home. And that care that they're receiving is often from a family member or from a friend. And that care varies. It can look like anything from assistance with coping with a difficult situation or coping with some memory loss that's occurring, maybe due to aging, maybe due to a traumatic brain injury, all the way to the hands-on assistance with things like activities of daily living like bathing or dressing. And so we know that those caregivers are often the ones that are keeping veterans living safely in the home where many of them want to be. We also know that caregiving can take a toll on a caregiver. Caregivers are very strong, but that care can often lead to increased stress and strain. And really, we have found that it can also lead to a general decline in their overall health, which is why it's so important for the caregiver program to help promote that health and well-being of each caregiver in a variety of different ways. The next slide, you will see kind of a visual graphic, if you will, of those two programs, of the PGCSS and the PCAFC. And the PGCSS is that bigger dark blue circle, and it has in it a lot of different things about the programs and services and supports we offer. And within that circle, you can see the second circle, which is that light blue circle of the Program of Comprehensive Assistance for Family Caregivers. And so this is just a visual representation that those who participate in PCAFC also have the supports and services of PGCSS. And we have quite a few supports and services in both of those programs, which I'm pleased to be able to talk with you about today. You can also see on the left-hand side of the screen, there are a number of different other ways that VA supports caregivers, and my colleague Cheryl will be speaking about that following this presentation. So I won't get into those, but you can see that there's a number of different services and supports such as respite and hospice and skilled home care. So there's a lot of different ways that VA supports caregivers, and the Caregiver Support Program is just one of those ways. If we go to the next slide, you'll see a little bit about the VA Mission Act. So for those of you who are aware, the VA Mission Act of 2018 was really designed as a larger act to improve veteran access to health care in a number of different ways. But as it relates to the Program of Comprehensive Assistance for Family Caregivers, it really allowed VA to expand eligibility to veterans of all eras and using that with a phased approach. The next slide. So just a little bit of background before we dive a little further into what Mission Act authorized us to do. But the Program of Comprehensive Assistance for Family Caregivers was established based on a public law back in 2010. And that law is Public Law 111-163. And this law allowed VA to provide comprehensive support to caregivers of seriously injured veterans who served on or after September 11th, 2001. And with the passing of Mission Act of 2018, expansion of this program to all eras was then authorized. And again, I noted that that is in two phases. So you can see here on the slide, the first phase, which happened as of October 1st, 2020, PCAFC expanded to eligible veterans who were seriously injured in the line of duty on or before May 7th, 1975. And then phase two will expand to eligible veterans of all eras. And we have that anticipated to launch in 2022. So let's talk a little bit about eligibility. So you can see here on the slide that there's just a couple of things that are highlighted, but I want to mention that there are very specific eligibility requirements for veterans here on the
Heather.
slide.
All right. Are you back with us, Ms. Christensen? We lost you for a moment.
Can you hear me? I see that my Zoom is reconnecting. I apologize.
I can hear you over the phone, yes.
Okay. Should I continue? Can you hear me okay?
It looks like you've muted.
All right. I think I had a little bit of an internet connectivity issue. Can you hear me now?
Yes, I can. We don't see your camera, but we can hear you if you would like to continue.
Okay. Apologize for that. So you can see here the eligibility criteria for Program of Comprehensive Assistance for Family Caregivers. I'm sorry, I'm having a little bit of internet connectivity issues. Not the best timing for you all. I'm so sorry. So I just want to highlight that there are actually 7 veteran eligibility requirements for the Program of Comprehensive Assistance for Family Caregivers. And so I'm just going to talk about a few of them, and then I'll point you to where you can learn more about those eligibility requirements. So first of all, as you can see in this first line, is that the veteran or service member who's undergoing a medical discharge must have a serious injury that was incurred or aggravated in the line of duty. And we define a serious injury as a 70% service-connected rating, and this can be a single or combined rating, and it can also include a presumptive rating for our service members. Secondly, the veteran must be in need of in-person personal care services for a minimum of 6 continuous months. And this need is based on either an inability to perform an activity of daily living like eating, dressing, bathing, toileting, or be in need of what is called supervision, protection, or instruction. So the need for supervision, protection, or instruction is really about being due to a functional impairment that directly impacts the veteran's ability to maintain their personal safety on a daily basis, and that's how we define that piece. I wanted to highlight that VA previously had required a connection between the veteran's need for personal care services and that qualifying serious injury. But with expansion, this connection is no longer needed, and a veteran can be found eligible for PCAFC regardless of whether the care needs are due to an injury or illness or disease. And this is incredibly important because many veterans have multiple conditions, and it may be difficult for us to determine which one exactly is causing the need for care or for personal care services. So for more information to read about all the different eligibility requirements, we really encourage you to go to our website, which is www.caregiver.va.gov. We have an eligibility fact sheet that spells out each of the requirements. So I just wanted to highlight a few of those requirements today, and then I want to talk with you a little bit more about the benefits and the process. If we go to the next slide. So once a veteran and a family caregiver are approved and deemed eligible for the program, there are benefits and services that are available to the caregiver. I'm not quite seeing that slide yet. Hopefully I'm not having technical issues. There we go. So this includes education and training, respite care, which is no less than 30 days per year, really being able to give caregivers a break in the care that they provide. Counseling, which is really important when you think about that toll that caregiving can take. Beneficiary travel to and from veteran appointments for that caregiver. That monthly stipend, which is that financial benefit that is paid directly to the caregiver. Access to health care via what we call CHAMP VA health insurance, and that's for those caregivers who are otherwise uninsured. And then under Mission Act, primary family caregivers are also eligible for financial planning and legal services. And VA is actively working to establish a viable contract vehicle for these services. So we look forward to bringing that information to you when it is available. Another thing I really wanted to point out is that this program is a clinical program. It's operated under the Veterans Health Administration, and so participants also participate in ongoing wellness contacts as well as annual reassessments as part of the program. And wellness contacts are conducted by clinical staff in our caregiver program to really help ensure the health and well-being of the veteran and the caregiver, and to really connect the caregiver and veteran to any needed services and support, making sure that they have what they need in the home to live safely and to provide that care. Next slide. So as we prepared to expand under Mission Act, we really heard from our stakeholders the importance of us having a standard process for determining eligibility across VA and to have consistency in the decisions that were being made. So with expansion in October of 2020, we implemented a standard application process across all of VA, and I'm going to really kind of give you a high-level overview of that here. So once the veteran and the caregiver's application is received by the Caregiver Support Program, a preliminary review is performed. From there, a veteran assessment, a functional assessment, and a caregiver assessment are completed by the Caregiver Support Program team. And the team at that point in time works to collaborate with the veteran's primary care provider to obtain input regarding the veteran's needs. Once all of those assessments are completed, those are then provided to what we call the Centralized Eligibility and Appeals team at the VISN, and those are our regional centers for VA. And this is a trained group of multidisciplinary providers that help to determine initial eligibility. Once initial eligibility is established, the caregiver is then referred to training and a home care assessment is conducted. That centralized eligibility and appeals team then verifies that the caregiver completed the training, they review the results of the home care assessment, and they make that final eligibility determination and stipend level decision, so level 1 or level 2. I want to again point you to our website where we have both of these steps laid out, as well as a visual graphic of the steps in the process, just so that it's really clear what happens once an application is submitted. So how does someone apply for the program? If you go to the next slide, there's 3 different ways that you can apply to the Program of Comprehensive Assistance for Family Caregivers. So you can go and complete the application online at caregiver.va.gov, and this is often the fastest and easiest route. But we also know that not everyone is comfortable with that, and so we have the VA Form 1010CG that can be mailed in to the local caregiver support program. You can always contact the program for assistance with that. And you can also always connect with your Veteran Service Officer for assistance in completing the application as well. All right, so if we go on to the next slide, I want to tell you a little bit about the Program of General Caregiver Support Services. So this is a program that provides resources, training, and support to caregivers of all era veterans. And so in order to participate in the program, all that's needed is the veteran needs to be enrolled in VA healthcare. You don't need to have a service-connected rating or a condition, but rather just be in need of help with activities of daily living or needing supervision or protection. Caregiver doesn't have to live with the veteran to enroll in the program, but rather they just need to be the one who's providing that care to the veteran. There's no formal application that is required. In fact, many caregivers will just reach out on their own. Maybe they've heard about us online. Maybe they've been referred by a Veteran Service Officer or the Veterans Primary Care Team. And so it's a really simple process to enroll in this program. The staff at our facilities will just do a brief intake to gather information about the needs of the veteran and talk with the caregiver about their participation in the program. And then the caregiver's enrolled, and we open up a caregiver's their own electronic health records so that we can really make sure that they begin to receive the services and supports available through the program. So it's really important that that our clinical staff just understands the situation that the caregiver's in and what they're facing, and help to develop a plan of care based on what the caregiver is looking for and desiring in terms of their participation. I want to highlight really 2 quick things too. If you're in the application process for PCAFC, you can enroll in PGCSS and begin receiving support right away. And also, as I mentioned before, that family caregivers who are participating in PCAFC can receive all of the services under PGCSS as well. So if we go to the next slide, what we knew is when we expanded under Mission Act, we knew that there would be a lot more interest in the program as well. We wanted to make sure that we were really reaching the needs of caregivers who are caring for our nation's veterans. And so we established what we called the 4 core elements. And you can see those here on the slide: education and support, collaboration and partnerships, outreach, and resources and referrals. So our education support is really that one-on-one support group support for caregivers who are caring for veterans. And they may want some weekly check-ins, they may want monthly check-ins. It's really kind of based on the caregiver's need. We have a variety of different groups at each medical center, some that are targeting specific diagnosis, some that are different geographic areas, and they can be offered in a number of different ways. So sometimes that's in person, sometimes it's via telehealth or a phone, knowing that sometimes it's hard for caregivers to get away and attend groups. And I'm going to tell you about a couple of specific education support that we offer at every medical center here in just a minute. Collaboration and partnerships, this is really about us coming together at VA and in our community to make sure that we're collaborating and partnering to make sure that caregivers in our local areas needs are met. So this happens both at the national level and the local level. Outreach, we want to not just wait for caregivers to find us, we're out spreading the word about what's available to you as a caregiver. And so we really are doing our best effort to try to make sure that we have communications out there to let you know that the support is available to you. And then resources and referrals. So our staff helps caregivers to get connected to the right services at the right time and the support that they need both at VA and in the community. And again, this is why our partnerships are so important, is because VA can do a lot, but we can't do it all. And we want to make sure that all of the services and supports that are available for caregivers and families are known to our caregivers. So if we go to the next slide, I want to just really highlight that over this last about year and a half, we've been able to hire staff across all of VA specifically dedicated to this program. We wanted to make sure that there were clinicians who were available at every medical center and that there was specific support available through this program at no matter which VA you're at. So what we've been able to do is standardize some of that programming that's available. So I want to tell you about two of those pieces of programming. One is called REACH, and this is Resources for Enhancing All Caregivers' Health. And this is a coaching modality that we use both individually and in groups. And this is really about working to directly target a problem behavior, for example, or a challenge that a caregiver may be facing when caring for the veteran, and to make sure that the caregiver has the necessary skills and strategies to continue to provide that care and to really be supported in their role. Again, we have this coaching based on specific populations like PTSD or dementia, as well as just for general, caregivers, regardless of what the diagnosis is. I think also a thing I want to highlight is that in those groups, what often happens is, caregivers have that chance to connect with others and feel less alone in their journey. And that's been such an important thing. The caregivers have really highlighted that getting together with other caregivers means so much to them. At every VA, we're also offering VA Save. So VA Save is a suicide prevention training for caregivers and for family members. And really, VA Save is for anybody who is interested in taking steps to help prevent suicide. And so we know that this is a very important role that families can play. And so we want to make sure that caregivers have the necessary skills and information that they need to respond to a crisis. So we have this SAVE training. We also have a suicide prevention toolkit that is available online for caregivers that helps talk about risk factors, protective factors, warning signs, how to do safety planning, and importantly also how to safely store firearms. And so this is a toolkit that you can go and access online today if you're interested. We encourage you to spread the word about that because you do play such an important role as a caregiver. Next slide, I'll just briefly highlight, we do have a number of national resources as well. Building Better Caregivers is an online training, helps with self-care. We have other self-care courses as well to help caregivers learn to care for themselves and manage stress. We have monthly calls where callers can come in and hear presentations and ask questions. We have a peer support mentoring program where caregivers can connect with one another, maybe connecting with somebody who's further along in their caregiving journey. This really offers that fellowship, decreases isolation, and really is one of our wonderful programs that we get a lot of feedback from caregivers about how much they appreciate this. We also have an Annie caregiver text program. So Annie will text you things like how important it is to care for yourself, reminding you that you're doing the right thing by helping your loved one, just really kind of inspirational text, but also practical skills text as well. So we have a number of different national resources available to our caregivers. And then I just also wanted to highlight that every year we hold both a summit and a resource fair. And the summit really brings together all of the different community agencies, again, to provide that wraparound support for caregivers. And so we are working with each local area to make sure that all those stakeholders are at the table to find out what are the gaps in the care that we're providing, what do we need to do to make sure that caregivers and families have what they need. And so this is really just showing you that we are coming together to make sure that we are engaging with one another and looking at what the needs of caregivers are. And then the resource fair is what's available to caregivers and families, bringing together all of those different partners and collaborators to spread the word, get you connected to the different resources at VA as well as in the community. And this is offered at every VA across the country. So please do take a look for that. If you're, interested in attending a resource fair, there's probably one near you in the coming year. Wanted to also highlight on the next slide, we have our caregiver support line available to you. And this is really available for caregivers, veterans, family members, and community agencies who are really looking for information about VA caregiver services. You can see here the hours that they're available and the number as well, and really encourage you to reach out and connect in that way. And then finally, I'll just quickly highlight that we do have a COVID tip sheet. So caregiving during the pandemic on the next slide talks about how to protect yourselves, how to obtain support during this challenging time, and the resources that are available. I will say it's been incredible to watch caregivers kind of rise up and support each other during this time, and it really shows the importance of community. So kudos to all of the caregivers who are out there as unsung heroes, making sure our veterans are safe in their homes. The final slide, just want to leave you with, how do you reach the caregiver support program? Well, we have our caregiver support line. Also on our website, we have a locator tool so you can find the caregiver support program team in your area. Really do encourage you to reach out and explore our website. We have a number of different fact sheets available for you. There's also a lot of different resources, little videos you can watch, little tips and toolkits that you can explore if you're interested. I realize I covered a lot of information in a short time, but hopefully this helps to give you some information and understanding about the services and supports that are available to caregivers. So with that, I will hand it over to Cheryl.
Good afternoon, and just as my colleague said, I thank you so much for allowing me the time to give you an overview of, my internet connection is unstable, so we'll hang in there with video as long as possible. But basically, what I'm going to be talking about today is actually a number of different programs that are part of the geriatrics and extended care set of services. And just as many of you probably are aware, geriatrics is a bit of a misnomer. We very much have these programs related to, that are available for veterans of any age. So age is not a factor in the programs that I will be presenting. Next slide, please. So as you can see, and as was announced initially, there are the home care services or programs are really bundled in two ways. One of which being those that are provided by VHA. So they are VHA staff who are providing this service, and then those that we purchase from the community. And so it would be external vendors or organizations that provide that care. Next slide. So what I'm going to be talking about today, because of time constraints, I'm not going to be able to go into huge depths, but I do want to give you kind of that broad brush of different things that are available. So within the VHA provided programs, we do have home-based primary care, medical foster home, as well as adult day health care. Next slide, please. And I do just want to point out that these are not all inclusive. So, I'm really trying to touch on some of the larger programs that that are available. But please know that you may, take part in other geriatrics and extended care programs that just we did not have time today to cover. So the first program that I did want to talk a little bit about is home-based primary care. And that really is for the veteran who is frail, has complex needs, and really needs to have a coordinated team provide their primary care within their home. So this is a group of clinicians, physicians, nurses, social workers, dietitians, who basically assess and provide the appropriate services for those veterans who really are homebound, but do not want to or are not ready for potentially a facility. So this is really an exciting program for those who are eligible. And the reality is that all enrolled veterans are eligible if they clinically need the service and if it's available. We are working on growing these programs. So, keep an eye out if it's not currently available for you. Next slide, please. So as I said, I'm kind of whooping through these, so I apologize for that. But medical foster home is actually a program that is affiliated with home-based primary care. So this would be for the veteran who may actually have the needs of a nursing home. So they really have that high need for, for care. But medical foster home basically is in private homes, and there is a trained caregiver that basically provides all the services that that individual needs. The medical care is provided by the home-based primary care team. So for all veterans who are in a medical foster home, they do also receive home-based primary care as well. So there is that connection and that tie to somewhat traditional VA primary care. Next slide, please. The third program is actually something that is a bridge between both the VA provided programs as well as those we purchase from the community. So adult day healthcare is really a program that if you are enrolled in VHA and eligible for community care, there are some clinical criteria that you would need to meet. But basically, this allows for, a daytime visit away from home, I guess. So this, you go in for somewhat social activities and peer support, and that would be really the community-based. The adult day healthcare that tends to be provided by VHA in some locations actually tends to be for the more complex, medically complex veterans. So it really has a range of what can be done. They also will help you with activities of daily living, and companionship. And it really is meant to both help the veteran as well as relieve the caregiver if there's any sort of burden that adult day healthcare may help relieve. Next slide, please. So as I said, adult day healthcare was the first of the programs that we actually offer both, depending upon where you are and what is available within your medical center. But now we are shifting to programs that currently are only available through outside vendors or organizations. So that includes skilled home healthcare, Homemaker and home health aide, Respite Care, as well as veteran-directed care. Next slide, please. And just with as I said, with the VA provided programs, this is not an all-inclusive list. So there may be, you know, other programs or services that we are purchasing from the community, so to speak. So the first being skilled home health care. So this really is meant to be short-term, you know, when, you know, a veteran may be discharged from a hospital, coming home from, you know, a rehabilitative stay, to really provide that that continuing care for, you know, for various needs. So, you know, this really is related to, you know, those skilled services and case management, physical therapy, anything that really needs a licensed or certified person to come in and assist. And just with, as with most of these programs, it really is, eligibility is really based upon the clinical need and your eligibility for community care. So, you know, it's not something that is based on, you know, your service connection. And as I said, this is really going to be something that is completed, or the care is delivered by a community home health care agency. So it won't be VA staff that are coming for the skilled home health care at this point. Next slide, please. The second service is very popular with veterans, and that would be Homemaker and Home Health Aide. This is a person who, again, is from the community, from an agency usually, who is trained and will come in and help with activities of daily living, and, you know, really help with personal care services. So it is very beneficial for, you know, for those veterans who may need a bit of help and really do not want to, you know, go to a facility. One of our big, our goals within the Office of Geriatrics and Extended Care is to really help support veterans as they age and go through the, just the span of, you know, of what their health brings, and allow them to really receive the care in the location that's preferable to them. So, so if being in the home is something that you, the veteran, wants, and it's something that we're able to help support you in, that is our goal. We do know that not all veterans are able to stay in their homes, and so we also have that cadre of facility-based services as well. But really, you know, it is very important to us to support your preference for where you receive your care and how you age. So again, I mentioned that this is that most of these programs are really related to are eligible for all veterans who are enrolled and are eligible for community care. And then there's also that clinical, you know, that clinical need. So it may not be the exact same number of hours for each person because there is a formula that goes into place related to that determination. Just be aware that for Homemaker and Home Health Aide, a copay may be charged based on the service connection and the disability rating. So just as an FYI there. Next slide, please. This program for respite care is, it is really set up to support both the veteran as well as the caregiver. So for those of you who are caregivers on the call, we very much understand that what you do is very important, and it is it's a very satisfying but tough job. And so by understanding that that caregivers do need a break, respite care is an option. So, you know, this could be for, you know, running errands, going out of town, you know, some short-term need that that will help support and give respite to that caregiver. So there are a couple of types that are listed on this slide. The first one being home respite care, which is what I was alluding to a moment ago. And basically, this is where a person, just as with the Homemaker, home health aide, or the skilled nursing, someone would come to the veteran's home and basically stay with the veteran and, you know, do what needs to be done while the caregiver has a break. For more longer term, there is the ability to have nursing home respite care. So this would be that trip out of town that, you know, that the caregiver does need to do for whatever reason, and not have to worry about the veteran that they care for. So this would be, you know, really a short-term, you know, stay in one of the CLCs, the community living centers, or a community nursing home. And basically the maximum for this is 30 days each calendar year. But very much we do understand the need to support our caregivers. And that goes for those within the caregiver support program, as well as those who are more, you know, in some of the other programs. Next slide, please. The final service that I'm going to talk about today is veteran-directed care. This has been a bit more in the news and become more popular, especially with the pandemic that we've gone through. So I do just want to say that we are working on expanding this program because it is not everywhere, but we're working on that. This is where veterans really are given a budget. So for services that are going to be managed by the veteran or the veteran's representative. So there is a counselor that basically helps, and the veteran hires their own workers. And this could be a neighbor, this could be a family member, but really it is giving that veteran the ability to hire whomever works the best to help them with their daily care. You'll see on the slide, there is a list of some of the activities that may be included with this program. And that is, you know, the eating, the getting dressed, the ADLs and personal care services, as well as grocery shopping. So, so as I said, this during the pandemic really was popular for those sites that do have the program. And we are working very hard at getting it, getting the program expanded beyond the locations that it currently is. Next slide, please. And I believe this is my last slide. Oh, one more. The last piece that I did want to touch on a little bit is technology. So many of you, as we've gone through this past 15, 16 months, have probably had some visits via telehealth in one way or another. Obviously, the pandemic probably sped up some of the methods that the VHA was really looking at moving towards, but we very much recognize that that technology is something that will be here to stay. So in addition to traditional telehealths, we're in the works of creating geriatric and palliative clinical resource hubs. And basically, these are really providing a set of specialists to be able to consult with the teams or the physicians, providers, clinicians that you all are working with and dealing with regularly within VA, but maybe they don't have the expertise of this particular group of specialists. So just keep your eyes peeled for additional advances in the use of technology for specialty services within home care. Next slide, please. And as I said, I so appreciate you taking the time. I know that this was very fast working through these slides. I know at the very end there will be a link to a va.gov site that does provide more information on all of those programs that I discussed, as well as additional geriatrics and extended care programs. So I know that was very fast, and I definitely appreciate your time and attention. Thank you.
Well, thank you very much to both of our presenters today for that information. You certainly packed a lot into a very short time. And I know we have received several questions, and our helpers behind the scenes from VA have been assisting their presenters in answering some of those. But I pulled out a few that I also would like to just hit on for everyone. So first, a couple of housekeeping on PDA's side. So the recording of the webinar you've seen today will be available later once we have it captioned. And we will also include the slides so that you can look at the slides individually. So stay tuned for that as we go through the process. Once the webinar is done, we have a little behind the scenes stuff we need to do, and then it will be available for viewing. We also had a question if there would be a transcript available, and I will check to see if that's something we can also include based on the captioning. So stay tuned for that as well. So now with just a couple of questions, and I'm going to go real quick back to Ms. Christensen with the Caregiver program. So first, can you remind us about which eras of veterans and eras of service, and eligibility? That's an ongoing confusion for some folks. Can you remind us about the eras of service that are currently eligible for the program and those that will be in the future?
Oh, absolutely. So right now, the PCAFC, the Program of Comprehensive Assistance for Family Caregivers, is open to those who served on or after September 11th, 2001, or on or before May 7th, 1975. In 2022, we will open to all eras. So it won't matter the era that you served and when the injury occurred, we'll be open to all eras. And we look forward to giving information as we have it available to you in the coming months and year.
Great, thank you. Another question we had was if you're somebody who's looking at the general caregiver program, is there a specific application process for that, or how does somebody access that?
Yeah, great question. So no application for that. Really simply just reach out to your local caregiver support program team, or call the caregiver support line if you want to figure out who that is, and that's the easiest way for you. So either using our locator tool on the website or through our caregiver support line. Those are two ways that you can reach them and just say, I'm interested. I heard about the Program of General Caregiver Support Services. I'd like to participate, and they will help answer any questions you have and get you enrolled.
Great, and just one follow-up.
In the chat box, if that helps, to put the website and the caregiver support line in the chat box for everyone.
Great, that would be wonderful if we could list that again. And also, is there any preclusion with the general caregiver program? Do you have to be service connected, or is that available to all enrolled veterans?
No need to be service connected. Anybody who's enrolled in VA for healthcare and who is needing care and wants to receive care from their caregiver, they are eligible to participate. So no need to be service connected for the Program of General Caregiver Support Services. Good questions.
Great, thank you. Well, now we'll switch it back to Ms. Schmitz and throw a few her way. First off, can you tell us a little bit, we talked about the Veteran-Directed Home and Community-Based Services Program, which, as you mentioned, is more popular these days. And we know that that's not available everywhere, but how does somebody figure out if it's available in their area?
Absolutely. So really, it would be starting with your primary care. So however you receive your primary care, that tends to be the way that we do get the most referrals. And it most of these services are based on clinical need. So, so we do need that provider to, apologies, I have something popping up on the side and it distracted me. So we do need that clinical input from a provider. So that is really the most straightforward way to access the services.
Great, thank you. And also we had a question about home respite care. And just could you tell us a little bit more about that benefit and maybe how it's accessed?
Absolutely. So it is similar to accessing any of the GEC programs, and depending upon what the respite, if it's potentially for caregiver support, I will say there are some different criteria and some different amounts of respite that are able to be provided. So it is really kind of going through, you know, the veterans provider and discussing that so it gets to the appropriate level for that assessment. But because a lot of these services, like I said, are related to the veterans' clinical status, we just have to go through a very specific process.
Very good. Another question that's probably in your area, Ms. Schmitz. So if a veteran needs someone to come to their home to help them with something like an ostomy, colostomy, those types of efforts, what programs might be available to them based on the ones that you talked about today?
Right. I mean, this really, depending upon what the need is, this very well may be something skilled, especially if it's, wound care or some different things like that. It might be a skilled program where, a specially trained nurse or someone would need to come out to do it. And so again, it would be that idea of, talking with your primary care provider or, a member of your PAC team that helps kind of coordinate those services for you. And let them know that you are having some difficulties with some of those activities that you have to do every day. Because many times they may not realize that unless you say it. So we definitely recommend that you bring that forward to advocate with your provider.
Great. Another question we had was about widowed survivors. So those who may be on pension and have aid and attendance eligibility, are there any services available to their caregivers through the VA? So a veteran survivor who might need those services.
I am going to have to take that question, and we will get the answer to the group before everything goes out, because I don't want to answer that incorrectly, because obviously there are a lot of nuances with all of these programs. So I will get you an answer. I just am not comfortable, giving my opinion without having the facts behind it.
Very good. Another question, this is back to you, Ms. Christensen, about the expansion. So again, it relates to errors. So if you have veterans who applied, maybe they're not yet eligible, they're really a phase 2 veteran, they've already went ahead and applied, will they need to submit those again when we get to phase 2? Or will it be there waiting for them? Have we had a chance to work that out yet?
So that's a great question. I know that historically it has been a new application would need to be submitted. I know I do have my executive director on the line. I don't know if you have anything further to say about this, Dr. Richardson. But typically an application would need to be submitted. I mean, an application can be submitted at any time, but it would be dispositioned if it was not the correct era of service.
Correct. So if somebody submitted an application that served outside of the current eras that we have the program open to, the application would be dispositioned as denied. And then yes, they would have to submit another application when phase 2 opens in October 1 of 2022.
Thank you. And thank you, Program Manager. we also have a question. I've heard this question a lot. So is the caregiver stipend taxable?
The caregiver stipend is not taxable, but it is considered income. So just keep that in the back of your mind. And I'm not a tax expert, so I won't comment any further than that.
Well, we appreciate that, because I know that is a question that we do get quite frequently from folks. We had a question about respite care that's available through the spinal cord injury system. And I did have a response from PVA's Director of Medical Services that some spinal cord injury systems with centers within the VA right now are only taking respite on an emergency basis because of COVID. But as a standard, they offer 2 weeks of respite care per patient per year. So keep in mind that right now it might be different because of COVID, but that in general, it's 2 weeks of respite per year. Do either of our presenters have anything to add about that specific nuance of within the SCI system?
Not specific to that, but I did just want to point out that in general, many of these programs do look a little different and may have some limitations related to COVID and the availability of the programs within the community. So for example, adult day healthcare, it may not be available in a community that is having a COVID flare, for example. Many have not yet reopened, even though, you know, some states and areas have taken down their state of emergency. So so just be aware that yes, some of these are in the pre and then post pandemic phase, as opposed to as we still may have some pockets that are not yet opened up.
Wonderful. Well, thank you so much for all of the discussion that we had today. This was very helpful. And really appreciate your willingness to answer questions. And I'm going to turn it back over to Roscoe now for some final words.
So on behalf of Paralyzed Veterans of America, we want to extend our appreciation to presenters today for presenting and sharing this wealth of information. And I hope everyone who participated in today's webinar has a better understanding about the status of VA's caregivers and home community service programs. This concludes today's webinar, and we look forward to everyone joining us on our July 20th webinar, where we will be covering VHA long-term care service programs. Thank you. Heather, I'll turn it back over to you.
Well, great. Thank you, Roscoe. And we do have up our final slide with Roscoe's contact information. Feel free to email him if you have any questions you didn't get answered today. We also have the links to PVA's website, the Caregiver website, and also the Home and Community-Based Services website. You'll be able to see all of these links once you receive the materials today. So thank you again to our presenters, and we hope to see you on our next webinar, which will be held on July 20th. That ends today's event. Thank you.